So Cedars Sinai is always focused on making sure that we keep our healthcare workers safe as well as our patients. So in environmental services, we are so important, even though we don't care for the patients, but we do care for them in another way. We take care of every square footage of the entire organization, whether it is ambulatory areas, outpatient areas, public areas, and all those areas we have to clean, that make sure that we have a safe environment.
We provide a lot of our cleaning solutions. So to ensure also nurses, they can clean all their equipment every time they go in and out of these COVID rooms. So we went also talking to them and training them how to use it properly. So we are very close with everybody, all the staff in general.
So in central transportation, we're responsible for transporting patients from the ED up to the floor, taking patients from the floor to procedures. When I get COVID-19 patients, I try to comfort them as much as possible by, I greet them. And then once I'm done doing the transfer, I'll wish them get better soon, just to try to comfort them and say that, we're all here, for you.
When every time I go in a room, sometime I go in the room and they're intubated, but they're awake. So they aware where they are. I say good morning, even though they cannot answer me. But sometimes they answer me with their eye or with their hands. They're like, wave me. And I try to be as friendly as possible, try to make them, because sometimes they're lonely. They have nobody around. So in between the nurses and us, we, made them like a family. And I think that's the way it should be.
I think, this has brought us together and also understand each other's role and how we can support each other. We definitely have, from other departments, and they said, how can we help? How can we be runners? How can we support, the nursing or even EVS? And it feels good that we're all in this together and we want to all make a difference for our patients and for ourselves.